have had an opportunity to present the update and subgroup analysis of the SPRINT study. The SPRINT study is the first randomized study for patients treated with lenalidomide versus the investigator choice. We presented the data already the last ASH, and we found that there is a significant improvement in terms of the progression-free survival for patients who had the chance to be treated with lenalidomide. There is a 39% risk reduction to die or to progress if the patient is treated with lenalidomide. And today we just presented the subgroup analysis, and just the main message is that there is a consistent improvement in all subgroups in terms of the previous treatment. So the patients who are refractory benefited from the lenalidomide treatment. The patients, regardless the time from the last treatment, they benefited from the lenalidomide treatment. And this is in a consistent way seen in all subgroups. So the main message is that the lenalidomide monotherapy compared to the other monotherapy significantly improves the outcome regardless the previous treatment or the previous status of disease. What we can learn from this study and from the other studies as well is that the monotherapy therapy definitely isn't the final answer. So it's very promising, but it's not the final answer. And the future definitely will be the combination of this targeted therapy with the other drugs. And we can use the chemotherapy backbone plus lenalidomide or some other drugs, or we can test or try to use the chemotherapy free. We already have some data in combination mainly with the rituximab, and in lenalidomide, in the case of lenalidomide, it's usually called R-square, rituximab plus Revlimid. It has been demonstrated that there is a significant improvement in terms of the overall response rate, and the toxicity profile is very good. So I think that this is the bottom line of all three meetings, the ASCO, EHA, and the next week in Lugano, that the combination of the targeted treatment can significantly further improve the outcome of the patients.